Evangelical Community Hospital staff members talk about their response last week to a mass casualty situation.
We received a call around 2:15 or so that we were going to be receiving a motor vehicle accident, a bus accident, and that we were going to institute hospital incident command. So that decide, how many patients we can take, what level of care they're going to be, and how we're going to accommodate them. So we did that initially, and initially we said we could take 9 patients. Is that correct, Dr. Devine? 9. And then after that, we were told that we had several other patients that were at a lower acuity level. And because this was a tour bus, we made a decision that we were going to accept as many patients as we could that were at a lower acuity level in order to keep them all together.
We actually took care of 30 patients who were registered with injuries. The first patient I saw was a gentleman with a mid-face injury, and it became very clear to me as I understood what fracture pattern he had on his examination and CAT scans that this impact was a very forceful impact that they have all sustained. Many of them had mid-face trauma. One had to be transferred for emergency surgery, and one was admitted to the hospital.
The response was tremendous, and I knew when I saw the initial response, I thought we can do this. We actually used our conference rooms in the back of the hospital as sort of little minor treatment areas, and we kept people together, and we had our nursing directors meet people. Dr. Connolly assessed at the door. We triaged right there. Either people had a bed, the waiting room, or back to Apple conference room. So those are the 3 areas that we utilized.
Involved in their direct care, and that was either from a care perspective or an immediate support perspective. I would say there were probably 40 to 45 individuals that were actively participating, and that may have been getting water, it may have been traffic control out in front of the ED, it may have been whatever element that is. And I will say that it was a community effort because these folks, once they were discharged, we started planning that about 30 minutes into the incident. What are we going to do with 28 individuals who are not from here, who have no resources really in this area? So the community came together and really found lodging and took care of that and transportation. And the bus company did a very good job and worked with them to make sure that all parties were taken care of appropriately. And